Welcome, everyone. We are Team PancreaTitans. My name is David. Also on the team, we have Kyle, Levi, Paige, and Namie. Now, we decided to organize our presentation around how to best work as a team and how to put Mr. Williams in the center of our care. Instead of working in silos, we wanted to come together and share our knowledge, but even that wasn't quite reaching our goal. We wanted to make sure that Mr. Williams and his family were part of the care team and that our care plan was centered around them. One of the first things we did was share with one another what we felt were the priorities of Mr. Williams. He may have expressed different concerns to us individually, and we wanted to know that we were on the same page. What we found is family is important to him, specifically going home to see his wife. We heard he's frustrated with all this time away from Eartha, and I just want to go home. We also see that community is important to them. Eartha mentioned it's so nice to have such good neighbors. Faith is important to Mr. Williams. He's scared about leaving this place and going on to the next. We also saw indirect signs of depression, memory loss, weight loss, loss of interest in previous activities. And we see that Mr. Williams expressed an interest in quitting smoking. We feel that that is a priority for his overall health. And of course, we cannot forget he's here for a COPD exacerbation, and we want to make sure to address that as well. The final piece in this first objective is to make sure we build trust with Mr. Williams, and we did that in two ways. First, by making sure we introduce ourselves as we go into his room. It can be confusing who all is coming to see him and who all is part of his care team. And the second piece we did is to make sure Mr. Williams is included in the medical decision making. How does he want to quit smoking, and how does he want to address his depression?
For Objective 2, we're going to describe the composition of our planned care team. The four main roles we think are most important in his journey post-discharge are nursing, occupational therapy, psychology, and social work. A nurse can bring a clinical perspective to the table and help him manage his physical needs, prevent illness, and treat health conditions. Mr. Williams' daughter-in-law, Betty, is already working to evaluate his vitals and treat any ineffective airway clearance, activity intolerance, imbalanced nutrition, and other COPD-related symptoms. She can focus on maintaining his progress and keeping track of his progress with the COPD after he returns from the hospital. An occupational therapist can focus on evaluating a patient's routine and environment to help a patient overcome the disabilities caused by illness so that they can carry out everyday tasks. For Mr. Williams, he's already reported difficulty and inability in accomplishing chores, so an occupational therapist can help him adapt his chores and his lifestyle and increase his ability to accomplish everyday tasks, especially in collaboration with his wife, who also struggles with a lot of chores. So a social worker can take into account lots of different factors to be able to provide the best healthcare resources for a patient, coordinate patients and insurance reimbursements, and bridge the gap between providers and patients. A social worker can take into account what the nurse and the occupational therapist have reported about Mr. Williams to be able to help Betty find the right agency for home health services based on Mr. Williams' financial, clinical, and occupational needs, whether those resources are assisted living facilities, home-delivered meals, transportation assistance, or anything else. And a psychologist can work with Mr. Williams to treat his depression, and taking into account all of the things that the other care team members have communicated, a psychologist can do that with a much bigger picture of what might be causing his depression and what his lifestyle is like in order to provide the best interventions to treat his depression and any other psychological issues that might arise post-discharge.
To ensure effective teamwork, we will utilize multidisciplinary rounds, handoffs, communication tools, and promote a culture that supports these initiatives. Our multidisciplinary rounds will be led by Mr. Williams' main care team. They will include Mr. Williams himself, as well as his family, and all people involved in his care. We will schedule these at a time that is convenient for his family and ensure there is time during the meeting to allow for input from his family. Additionally, we will offer alternative attendance options, such as Zoom, for people like his daughter who lives far away or any care team members in other locations. We will also utilize handoffs between shifts and before and after specialist appointments. These handoffs will ensure that knowledge isn't lost and that care is maximized for Mr. Williams, thanks to his providers sharing updates and findings during transitions of care. Research-backed communication tools will also be important for assuring effective teamwork. Some of these include SBAR, which stands for Situation, Background, Assessment, and Recommendation, Close-loop communication, and read-back, repeat-back. These tools will help us promote clear and efficient communication between our vast number of team members. Lastly, we will promote a culture of respect, inclusion, willingness to learn, and leadership. In this culture, all team members will be valued and appreciated for the role they play in Mr. Williams's care. All team members will learn from each other, including from each other's mistakes, and there will be a designated leader of our team with whom people are comfortable raising concerns or questions about Mr. Williams's care.
Our fourth team objective is going to focus on ensuring effective communication between Mr. Williams and his providers. Here are some inter-team examples. Ensure that current and past health records are made available to all providers via Mr. Williams's medical release waiver form. Establish Mr. Williams's common healthcare goals across all providers, and discuss updates on Mr. Williams on a monthly basis amongst providers. This aspect is crucial for the well-being of Mr. Williams. For example, if Mr. Williams is prescribed a short-term steroid by his osteopathic physician after receiving manipulation, it is vital that his medical records reflect this as to ensure another provider does not accidentally prescribe a similar medication for his acute illness. Here are some examples of inter-family communication. Ensure that both Mr. Williams and his wife are aware of the most up-to-date status reports from Mr. Williams's healthcare team. Encourage patience and understanding from Mr. Williams towards his wife due to her dementia. Help Mr. Williams understand that his wife's condition makes it difficult for her to remember things. Urge Mr. Williams to talk frequently about his conditions and how he feels about them to help prevent any feelings of depression or isolation from developing. Finally, due to the multitude of Mr. Williams's healthcare providers, it is important to make sure that Mr. Williams has a complete understanding of his condition. It is vital that Mr. Williams's healthcare team understands his concerns, wishes, and the role and status of the rest of the healthcare team.
At this point, I want to talk about quality improvement and safety. There's growing evidence that integrated care is linked to higher quality outcomes and lower costs. Part of this is due to the lack of repetitive and therefore unnecessary activities. This helps take some of the burden off of Mr. Williams, as he won't have to duplicate his actions or tests, which result in higher patient satisfaction as well. Integrated care also helps ensure that everyone involved is on the same page with Mr. Williams' motivations, goals, and where his progress on his goals is at. This also helps provide an easy way so that everyone involved in his care understands his physical abilities and limitations and will prescribe such things that will not endanger his health due to a weakness in an area of his health that isn't their expertise. Telehealth has grown this last year and can be a great benefit to Mr. Williams. This would enable him to contact health services without having to figure out how to get around that day, have his daughter drive him while having to make a 5-hour round trip herself, or potentially have someone accompany his wife while he's going out of the house for care. This also has the added benefit of reducing his exposure to COVID-19 since he will be staying home more. If he does need to get around more, we can help him get set up with the Bluff Area Transit Service, which is a relatively inexpensive transportation service in his area. Lastly, we will advise him to get a vaccine for COVID-19, since his disease would put him at higher risk for complications if he contracted COVID-19, and we would help him get through that process if necessary. This concludes our presentation. Thank you.